Alright, these are medications that I didn't think I'd see so often in the hospital, part 1. First on my list is meperidine or Demerol. Meperidine is a weird little opioid. We don't really use it for pain anymore because of this toxic metabolite, normeperidine. It causes neurotoxicity like tremors, seizures, hallucination, and accumulates with renal dysfunction or kidney dysfunction. Another little interesting thing is it has anticholinergic activity as well as serotonin reuptake inhibiting activity. See this for actually in the hospital. As needed post-op rigors and chills. There's a little history with this drug too. I don't know if you've heard of the Libby Zion case. Libby Zion was an 18-year-old that was on a monoamine oxidase inhibitor called phenelzine. We don't really give people monoamine oxidase inhibitors anymore due to drug interactions and side effects. And she was admitted to the hospital for some sort of flu-like illness. 2 resident physicians were taking care of her, a PGY1 and a PGY2, and they decided to give her meperidine for strange jerking motions. She got more and more agitated and they gave her Haldol. And by the morning she had a fever of 107 degrees and suffered a cardiac arrest and she died. Because of this case, there's a restriction on how many hours residents can work, but that's what I think of when I hear meperidine. What happened in this case were classic symptoms of serotonin syndrome. This is something that pharmacists watch out for with serotonergic medications. Phenelzine and meperidine are contraindicated because of this risk. I guess I can explain this, but this is serotonin, 5-HT, stands for 5-hydroxytryptamine. Here's monoamine oxidase. It oxidizes monoamines. There are actually 2 monoamine oxidase types, MAO-A and MAO-B. So here we see this enzyme degrades serotonin. This little thing, 5-hydroxyindyl acetaldehyde. So phenelzine blocks this enzyme and it basically blocks the degradation of serotonin via this pathway. Monoamine oxidase also breaks down dopamine. That's why we have some MAO-B selective inhibitors specifically for Parkinson's like selegiline and rasagiline. Also mentioned that the antibiotic linezolid or Zyvox has some monoamine oxidase inhibiting activity, so we generally avoid serotonergic meds with linezolid and other monoamine oxidase inhibitors.